I mean, I'm guessing you're talking about as a source of nutrients, because of course
Yes.
there's lots of
Yeah.
other things outside of nutrition that impact the immune system. So I think one of the real difficulties is where people have researched the influence of some, let's call them immune active nutrients, things like vitamin D, vitamin C, zinc, selenium, and so on. Those studies have often been done for convenience sake through using supplements rather than
Hmm.
through using foods, because it's easier to do trials with supplements than foods. But as a result, they've used intakes of those nutrients that are higher than can be achieved from most diets, even
Hmm.
the sort of diet that I talked about before. And I think vitamin D is a good example here, where studies investigating vitamin D and the immune system use levels of vitamin D that can't be achieved through the diet, actually. Studies of zinc have usually used intakes of zinc that are beyond what is easily achieved in the diet.
Hmm.
So I think it's possible that for some specific nutrients, actually diet may not be enough in terms of providing the amount of those nutrients that the immune system really needs.
Hmm.
As I mentioned, vitamin D would be the best example of that. I do think, however, that food first is the way to start.
Hmm.
But there is this complication of delivering the amounts of those nutrients that the immune system really needs to support its function.
Yes, and I wonder as well, over the last year, totally understandably, the people's stress levels have been a lot higher. And certainly when people are stressed, it seems to be that the utilization of vitamins and minerals is greater. And I know, certainly personally speaking, I'm taking a multivitamin and mineral at the moment that I wouldn't perhaps normally do, and I do find the benefit of it. And maybe it's just myself, maybe it's just my observation about stress levels. So I wonder at the moment whether people generally could benefit from a multivitamin and mineral. It
Yeah, so
certainly seems it.
yeah, I think you raise a really interesting point, which is there are many factors that influence people's immunity.
Mm.
So age is one of them. So our immune systems decline as we age. Um, Physical activity is another. So people who are physically fit, all other things being equal, seem to have better immune responses than unfit people. Um, Other things like alcohol consumption, cigarette smoking, they impair
Yeah.
immunity. Being overweight or obese
Yep.
impairs immunity.
Hmm.
Um, but then there are some other things, and we've touched on diet, but stress, which you mentioned, stress um, impairs immunity, both physiological stress and psychological stress.
Hmm.
And that's because the stress hormones that are released into the bloodstream actually dampen the immune system. So, what that means, and this is why your question is really interesting, is whether in stress states we need more of the other things that help the immune system along. So, in other words, we maybe need more of these important nutrients
Yep.
when we're stressed than when we're not stressed. Or maybe nutrition becomes more important when we're stressed than
Yeah.
when we're not stressed. So I think you raise a particular scenario which you're sort of investigating in self-experimentation of whether supplements of nutrients that support the immune system could be very valuable in stress situations. Now, when people have studied the impact of these nutrients on the immune system, often they have studied them in stress situations, in fact. For example, in people doing intense exercise, or in people under exam stress, for
Hmm.
example. There are interesting studies there. So stress is often used as a challenge to the immune system to test the effect of nutrients for exactly the reason that you raise. So I think your point is a valid one, that people under stress maybe have a higher need
Hmm.
for these nutrients.
Yes.
Yeah.
I think it's, yeah, and it also it's kind of like a safety blanket as well, isn't it? If you're not sure if your diet is sufficient, if you're including all the right types of food groups, then it is certainly at least something as a minimal approach anyway.
Yeah.